Our presenter today is Mark Avery. Mark is the Director of Missions and Outreach for Zarephath Church in New Jersey. He also serves in several community networks and is, over the last 15 plus years, has been advising churches and ministries around the world. Some of his background: he has a PhD in partnership development from Fuller. He taught partnerships and systems thinking and design work courses. He's led workshops and consultations for 100 plus ministries and networks in Europe, Asia, and the US for over the last 15 years. A couple personal notes. He lives in New Jersey with his wife, Asha, and two daughters, Jessica and Fern. He loves trekking. He loves carpentry, working with his hands, with motorbikes, and of course, chocolate. He is a fiend for Cadbury chocolate. So if anyone wants to thank him or connect with him, then chocolate is probably a great way to open the partnership discussion. So with that, let's turn it over to Mark for our conversation today. Thank you, Mark.
That's great. Well, thank you so much, Dan, and thanks to Vision Synergy for arranging this this webinar. We're really looking forward to this. Design thinking has become a really key part of my life. I got involved in partnerships many years ago, and just have really just become passionate about this idea that there's things that need to be done that can only be done if we work together. And so this webinar is a wonderful way to express that and share some of that. So we're going to be talking today about design thinking. And there's going to be a whole range of background for the participants. Some people are very experienced with this. For some of us, it's going to be the first time that you're hearing this idea of design thinking. So we're going to unpack some of that. Design thinking helps networks to take on complex challenges by helping us to create a shared understanding of our context and then build from there. So essentially, that is the value added for design thinking to your network or partnership, is it helps everybody to build a shared picture of your situation and then build out partnership from there. So let's get started actually by looking back at the form that I had you guys fill out before this partnership, this seminar. And we're looking at the word partnership specifically. And what are our ideas and our thinking related to what does the word partnership mean? What are some key concepts in there? So this is a word cloud that was built from the feedback that came back from those who participated in that before this seminar. And as you can see here, the word collaboration, dividing a task into multiple parts and seeing how we can co-labor, work together to do that. Multi-organization, I like the word synergized energy. That's great. The word synergy comes up a couple times. So this is an example of how we're going to use this particular tool called Menti in our seminar here today. And it gives us real-time feedback. It allows us to participate a little better. You're going to see that design thinking is a highly iterative, highly collaborative process. And this tool helps us to get some real-time feedback and better experience of the design process. All right, I'm going to start us off just with a personal story. I am a TCK, so I was born in England, lived there till I was 4, lived in Belgium till I was 8, came to the USA, lived in Nepal for many years as a missionary, and then India later on as missionary. So if you ask me where I'm from, I have absolutely no idea. But right now I live in New Jersey. And so this diverse background really just was important in giving me the idea that there's more than one way to do things. When I was young, when I was about 20, 21 years old, the Lord very clearly called me into missions. And when he did that, I had a very simplistic idea about what that meant. So my prayer was essentially, Lord, here I am. Here's my life. Take me and use me for your will. And later on, got through college, got to the field, and I found that when I got to the field, there was actually many people there with the same idea. Lord, here's my life. Take me and use me as you will. After a couple of years on the field, I really started to switch my mentality and just started to ask the question, why aren't we working together a little more intentionally? We're working together in the sense that we're all here, we're all doing mission work, but from the perspective of the people we're serving, would it make more sense if we work together more intentionally? So the question of do we work together, since we're all in the same place at the same time, doing the same thing, talking about the same Jesus with the same message, yes, we're working together already because we're all here. But we can make the choice to do that more intentionally or less intentionally. And I think that's where that question really started to emerge in my mind. Now, I had a fairly simplistic idea about what partnership was. I think I thought of it more in terms of like a big bang type of project. And so when I had the opportunity, I went back to study that. So I basically went to college and said, what is this partnership thing? Is partnership kind of like communism, great idea, but just doesn't work in the real world? Or is partnership something that really does have potential? And I walked out of there with the idea that, we have to not only keep talking about partnership, there's some things that can only be done in partnership that need to be done. I got back to my context of ministry and started to share this with the people around me. And like many of us here, got a lot of nodding heads and maybe a lot of participation in initial meetings, but really found it hard to move across that step outside of organizational boundaries to start thinking cooperatively about the strategy of mission. I'm sure that many of us have faced that type of barrier. Where design thinking comes to the fore here. See, I think when I came out of the studies on partnership, it was really clear to me, we all bring different things to the table, but I was still looking at how do we form connections between the people who are working on missions. And what I started to realize is that the most useful conversation is actually not about us. The most useful conversation is when we focus on the people that we're there to reach. That changed a lot of things. See, that's where design thinking really, really comes to its fore, is it helps us to create a shared collaborative picture of the context in which we're working. And as we do that, the need for partnership becomes very, very clear. And we start thinking more ecologically about what we're doing in partnership. One person has a wheelbarrow, one person has a watering can, one person's planting the seed, another person's digging the ground. But we're working in different areas and not necessarily on the same project, but it all converges within the health of the garden that we're working on. And getting a partnership to think in those ways is where design thinking really comes to the fore. So let's look at that for a second. Essentially what we're saying here, the main point here is that every problem, every project that we consider within our partnerships or networks, that problem, that project has a context, a wider context which is beyond our boundaries. And design thinking helps us to understand that problem or that project in its context. And that's a very important step for us to take. See, the thing is that when we look at our context of ministry, a lot of us will look at it not simplistically, but as a simple situation. Here's the thing. To a hammer, everything looks like a nail. So if I'm a teacher, I look at everything through the lens of education. If you could just get the people into the schools where I teach, we could solve all these problems in a generation. Then you have the evangelist. If you just let me preach the word to all these people, they would all come to know the Lord and we would be in a much better situation. Then you come to a doctor. Well, the problem is people are dying long before they hear and understand the gospel. Let's create these hospitals and bring people together. See, the thing is, we're all looking at our context. We're all important within that context, but we're looking at the context itself simplistically. But we come with our best practices. We come with our piece of the puzzle. We bring that to the context and we say, Lord, I can't do everything. I can do this, so help me to do it to your glory. The thing is, within the life situation of the people that we're serving, that context is much more complex. There's a lot of interdependencies within that context. There's a lot of change going on in that context. And what happens is, from the perspective of the people that we're serving, life is actually extremely complex. It's not simple. And so design thinking helps us to empathize more deeply and make sense more deeply of the situation that the people we're serving are actually living in. And the way that we structure ourselves, the way that we respond to that context is a much better fit when we use design thinking, because we're leveraging and we're managing the complexity that we're seeing. So partnership is going to make more sense to more people and be more effective if we start to see, realize, and better manage the complexity which is real in our context, whether we choose to manage that complexity or not. See, this is the thing. Sometimes a simple solution doesn't work out. KISS is a great, get to something doable phrase that we use. But the problem is that simple solutions to complex problems often create unintended consequences. So we're going to look at a story for that. Let's say that this actually happened in the country of Ethiopia. There was an outbreak of a preventable disease. So they brought the medicine to Ethiopia, and they wrote everybody prescriptions. One tablet for once a day for 10 days will keep you from dying from this disease. Now, there was a problem there. That was a simple solution and a workable solution to a problem. The thing was that the context for that problem was not considered. The context for that problem was within the minds of the people who were sick. Within the minds of the people who were sick, they were thinking, well, I have 10 pills here. So if one pill once a day for 10 days cures me in 10 days, I don't want to be sick for 10 days. I want to be sick for 1 day and then cured. So I'll take all 10 pills at one time in 1 day. And unfortunately, many people were progressed enough in their disease, their body was weakened, they were dying from the medicine. Simple, workable solution, the right solution to a complex problem, created an unintended consequence of killing people with a medicine designed to save them. There are thousands of different stories with the same type of outcome within our mission context as well. And I'm sure that as I'm talking, you can think of many. So here's what happened. They called a design workshop, and they called many national people into that workshop. They said, how do we get this message across to this context? They said, well, this is a really important thing. Let's talk about this. And they came out with a solution for songs. And they turned the prescription into a local song. They said, this is how our traditions are passed down through stories and through songs. So they made a song, and then they taught it to everybody who came for the medicine. And the miracle here was that understanding of the dynamics of the context translated into the action that these people were taking created a better outcome. So all of a sudden, this more complex understanding of the situation led to a more refined response to that problem, a better response, and less people died. So the probability of the outcome that they were looking for was higher because they took a context-based approach. Now, we've done that in missions as well. Within the context that my wife and I were in Southeast Asia, we worked for many years in one country with this people group, and then we moved to another country to work with the same people group. And we walked in sort of with the idea, well, we know this group, we know their situation, so let's kind of leverage that learning. The problem was that the camp said, no, we're actually good, thanks. We don't need you, you're a foreigner. Thanks very much, have a good day. And so we tried for probably a year to find a way to gain presence within this community, and we were just hitting a brick wall constantly. So what we did is we called a design week. Literally for 5 days, we all came together with national believers from this people group. And I think there's one other foreign missionary there in the group, but primarily nationals themselves. And we asked this question: how do we gain presence for the gospel within this people group? And we used 5 or 6 different design tools that week, and we walked out of the hundreds of ideas that we had. We walked out of that with 5 priorities that we were going to focus on during our time there in mission, and those 5 priorities defined the work that we were doing for the next 5.5, 6 years. And the amazing thing was, as we used design thinking within the partnership we were in, as well as our own team, we started thinking much less about individual projects and more about increasing the likelihood of the outcome we were looking for, exposure to the gospel within that context. It made us much more agile. It made us think much more clearly about our situation. We were thinking about what's likely to be useful in terms of getting people's exposure to the gospel. And the impact that we had coming out of that design session, being able to prioritize those 5 things, the impact that we had longer term was incomparably better to what we were working on before. So I'm a real champion for this application of design thinking to partnership development, to unreached people groups, because I've actually experienced the impact of that in my own life and ministry. So I think as we get started here, it's important for us to have a shared understanding of the terms that we're using. So I'm going to give us a Centrepoint definition. I'm not going to try to be very refined about all the terms we're using. I'm just going to give us a center of reference. So partnership is about actions that are designed to reinforce each other towards a specified goal. So you have a shared intent, and you're taking actions that are all part of the larger ship, all part of the larger intervention that you're trying to seek. When we talk about impact, we're not talking about just the outputs of a program. We're talking about the larger outcomes of all those interventions within the system that we're working with. So there's an intentional change on a systems level as a result of the actions we're changing. So it's not just we started a training program, we trained 10 pastors, and now 10 pastors are trained. That's not the type of impact we're talking about. We're talking about a larger type of impact where the community itself becomes more receptive to the gospel over time. It's much more long-term than a short-term program outcome or impact would be. That's what we're talking about, systems level impact, which is much harder to get. When we talk about strategic, we're not talking about the word strategy. A strategy is a plan. Everybody has a plan. Everybody comes to the table with a plan. A plan could be more or less good. A plan can be more or less useful in this situation that we're in. Strategic means that our action, our plan, our strategy makes sense in the context we're actually working. So when we use the word strategic, what we're saying is not we have a plan. What we're saying is our plan makes sense in light of the context where this is going to be implemented. So strategic thinking is actually a sense-making activity within the context that you're working in. So let's come to the key idea here, design thinking. Design thinking is a creative process, but it's also an empathetic process. It does not begin with our key competency is teaching. Our key competency is medicine. Our key competency is whatever it is. It doesn't start with our key competency. Design thinking starts with deep empathy with the life situation of the person that we're serving. And that is the unique distinctive that design thinking brings to the table for partnership development, and why it's so important. For complex problems like we will start to see as we use design work and design thinking, complex problems infer a collaborative response. And so that's what we're talking about today. Now, to be as specific as we can be about the focus here, design thinking is a nonlinear. In other words, it doesn't follow a set schedule. It has structure, but it doesn't have a set schedule. It's an iterative process. We talk a lot. It seeks to understand the end users, the people that we're going to. It's very good at challenging assumptions that we walk in the room with. It helps us to look at the problem in new ways, redefine the problem. The idea is to come up with a creative, innovative solution or response, and then to think through, okay, let's prototype. What would this actually look like, and how would we test whether or not this is actually working? The method generically has about 5 phases. We empathize deeply with the person that we're working towards. We define the problem, the situation that we're trying to change. We ideate, we create ideas, we prototype responses that we're going to take, and then we have a test where we can start testing, is this actually having the impact we were hoping for? So this is not useful for every type of problem. If you're looking at how to get a nail into a piece of wood, you don't need design thinking, you need a hammer. If, on the other hand, you're running out of wood and your problem is how are we going to build things now that we don't have wood, that's a complex problem. So that's where design thinking is most useful. It's when you want to tackle problems that are abstractly or ill-defined, and there is no best practice for the situation that you're in. And I think for most partnerships and networks in mission, that would define our situation pretty well. So when we're thinking about design thinking, systems thinking, there are thousands of things we can say about that. I'm going to say 2 things just to get us oriented here. First of all, when we do design work, it's very important that the focus is very clear. Systems have many elements to it, and for you to make sense of your action within that system, your focus of impact needs to be very clear. So just like in a garden, the focus is the plants. In a school, the focus is the child. In mission, the focus is the person who has not heard the gospel yet. You need that to make sense of your action within a system. So I want to make that point because that's going to be very important in a couple minutes. Second is that when you're working with systems, there are so many parts to a system. There's so many things going on within a system that when you come to a system from a collaborative perspective, you start to realize, we could actually change thousands of things. So when you could do anything, how do you decide what to do? In making that decision, that's where design thinking really shines. I think most of us have experienced the transition from the formation meeting to operation. So where you have the formation meeting and you're saying, do we want to work together? Yes, we want to work together. You form the partnership, you form the network, and then all of a sudden the central question changes. The central question is no longer, do we want to work together? The question is, now we are working together, now what are we going to do? How are we going to leverage and realize the potential of collaboration? So I'm going to give us an example here with this image. This image is a good picture of, let's say, a partnership focused on ecology. So we want to make a park a very healthy park. So we form a partnership. A grass expert comes into the table, a bird expert is sitting at the table, a fox expert, a tree expert is sitting at the table. Just like in our mission partnerships, you have linguistics, you have cross-cultural dynamics, you have pastor training, all of these people are sitting at the table of partnership. So the problem is that when we start thinking about our context, number one, we may not have a shared understanding of how it works, and number two, our understanding may be flawed. So this is where systems thinking and design work really comes to the fore. So let's say that we're walking to the table with this idea of how the ecology of our garden works. The problem is, with this depiction of the garden, this garden is going to die within a single cycle. And there's one arrow within this diagram that needs to change. So just as an activity in systems thinking, you're actually going to do systems thinking right now for the next 30 seconds. Find the arrow in this diagram that needs to be reversed in order for the system to work. Okay, here's the thing. Within this system, the reason this system dies is because once the worms and the bacteria have eaten all that they have to eat and they die, nothing else regenerates. The thing is that worms excrete soil. So the arrow that needs to change here for the system to survive is this one. It's a purple arrow from the worms and the bacteria that create the healthy soil back to the tree, so this whole ecological system can continue to grow. So this is an example of how systems thinking, how design work, how graphing the situation as a whole can really help us to determine what a strategic intervention is going to look like, as well as the importance for understanding how the situation as a whole is working. So here's the thing. Some people are wired to really think theoretically, other people are not. The thing is, all people have theories. Every single person at the table of partnership, whether you consider yourself a pure practitioner, a pure theoretician, or a reflective practitioner, I think is the term, every single person walks to the table with their theories about how life works in the situation that we're in. The thing is, all theories are wrong. All theories are wrong because they're incomplete in some manner. We're not omniscient. We see what we see, we miss what we miss. They're wrong in terms of we don't know what the consequences of future actions are going to be. There's all kinds of things about the life situation of the people we're serving that we just don't know. So every theory that everybody walks to the table with is wrong in some manner. Thing is, most of the theories we walk to the table with are actually useful in some ways. And some of those theories are much more useful than others. Now, I know that might feel a little inappropriate in a Christian environment, right? We want to value everybody. The thing is that some of us have more of the picture and some of us have less of the picture. The question for partnership is not who's right and who's wrong. We're all wrong. The question for partnership is what makes a theory useful. So when we come to the table and we talk about what we're actually going to do to leverage the potential of our partnership or network, what is it that's going to make the theory that we come out with more useful than with the one we walked in with in the first place? So that's an important question for us to ask. I think most of us are familiar with just the basic process of we plan what we're going to do, we do it, and then we measure the impact. That's something where most of us are familiar with. The thing is that over time, we have found that getting ideas from people, ideas about what we're going to do, what we're going to plan, that helps to develop a sense of ownership. We've also found over time that if we can explain how our ideas are going to create the change, a story of how if we do X, Y, Z, it'll have this impact. That's something very important, especially when we go looking for grant money in order to fund that. The piece design thinking brings to the table is actually before that. Design thinking helps us to develop a theory of how life works here. In other words, why here, now, would these interventions make sense? If we can explain the why, then our description of how things work is going to have more impact. The ideas that we have are going to be more based within the situation. The plan, the action, the impact are all going to make more sense if we have a shared idea about how things work here. So that's the piece that design work brings to the table. In short, it gives us a higher probability of better outcomes for our context because we've taken the time to create a shared understanding of how things work here. So we're going to try that out. And in the context of this seminar, we're going to say that we are going to be part of a partnership to save Asha. So we're the Save Asha Partnership. And the focus for this partnership, the design question that we're going to be working on in this seminar is how can SAP reduce, in other words, the Save Asha Partnership, How can the Save Asha partnership reduce bullying for immigrant girls in California schools? So we're actually going to work on that. We're going to use a design tool to give you an example, a feel for how design work could actually apply to this. Now, here's the thing. Design thinking, it is a dynamic, it is a high conversation process, but it does have structure to it. That there's specific things and things that you can do at different times to make the conversation much, much more useful. And so we're going to look at how that works within this seminar focused on bullying. So here's what we're going to do. We're going to actually build a shared understanding of Asha's situation. Now, the first step is actually not empathy. The first step is to be self-aware of the fact that you're actually looking at interacting with her situation. So the first question is not about Asha. The first question is about us. What piece of the puzzle do we bring to the table? That self-awareness is very, very important before we dive into all these complex conversations about Asha's life situation. So I want each of you to take out a pen and a Post-it note or scrap paper next to you. And I want you to write down what you would put if you were to, you personally were to create an agency or take up a role within a school setting where bullying is happening, and you were going to be an active part of preventing bullying within the school. What would that part be? What do you bring to the table specifically to help lower the probability of bullying in the school? So I'm going to give you just 30 seconds to say, here's my piece of the puzzle by personality, by your role, by your experience. Here's what my piece of the puzzle looks like in the fight against bullying. Go ahead and write that down on a piece of paper. Now, this is for you personally. If you personally were to act or to create an agency that revolves around your fit, what would that be? It's very important to have your piece of the puzzle clear. All right, so once your piece of the jigsaw puzzle is very full, then there's very clear, then there's a second step that we need to take. And that second step is to unpack the best thinking you have now. Here's the thing. Everybody comes to the table with a pre-existing theory of how things work and a pre-existing idea of here's what we need to do. If we could just get the administration to do this, if we could just do X, Y, Z, all the bullying would stop. And for a lot of us, we have some excellent, some exquisitely good ideas about how to stop bullying. The thing is, if we don't unpack that first, we're going to try to drive every conversation towards our idea. So the best way to handle that is to capture those ideas and put them in a vault right at the start of our design activity. So I want you to do that. I want you to just, on a separate Post-it note or below on that scrap of paper, I want you to write 3 of your best ideas about how to prevent bullying within schools in California of immigrant girls. I'm going to give you 60 seconds to do that. Write down 3 of your absolute best ideas about how to prevent bullying in California schools to immigrant girls. Okay, so notice how I did that. This is part of the facilitation of the design process. Give people a clear task, but also make it time limited. Design work is much like research. It never, ever ends. You just have a point at which you stop and then you pull things together again. So those are the first 2 steps that are very important for us to take in design thinking. Clarify exactly what your design focus is. Have people design, this is what my piece of the jigsaw looks like, and then have people unpack the best thinking that they have right now. And make sure that you have a place where you store those ideas. So if this was a design workshop, we would be storing them in an area that I would call the vault, which is a great big whiteboard or window where all those ideas are put up for all to see. For here, we're just going to have you keep them in your notes for now. Okay, third step. The third step is really where design thinking shines. And the third step is really where we're going to use a structured conversation to empathize very deeply with Asha's life experience. Now, when I'm doing these design seminars, there's three things that I say about the story. It has to be true. It has to be based on life events, real life events. It has to be total. In other words, it has to focus not just on the crisis of bullying. It has to have a much wider scope in time. So looking at her whole life situation. And then it has to be typical. It can't be those one in a million highly exotic kind of stories. True, total, typical. So true based on real life events. Total, it expands the scope at which we're looking at her life in time. And typical, it has to be based on what you would typically expect to happen. A common aspect of her life story. True, total, and typical are the three things that we do with a story. Now, we don't have time to create a story, so what Dan and I have done is actually have one preloaded for you. So I'm not sure how many people have printed the file, but there was a PDF that went out to you for this webinar. And I'm just going to give you a few seconds to find that document and read through it. I'll talk while you're reading. Essentially what that is a tool called a timeline tool. And it creates sort of a table of contents of Asha's life. So I'm going to just give you a few seconds to get familiar with that. Now, I don't want to give us too long because I know some of us maybe can't find the PDF for one reason or another. So if you're reading, continue to do that, but I'm going to talk us through the tool. The essential idea of a timeline tool is that it helps us zoom out from the crisis event to see that crisis within the context of the person's life story. So here's what we do. We create a table of contents of that life story to help us zoom out. We empathize very deeply with what's happening within each chapter of the story. We gain an understanding of this person's story over time. Then what we do is we connect into that chapter. We say, here's my piece of the puzzle. Where could I fit within this chapter of this person's timeline? So it helps us zoom out of crisis intervention into more of the preventative work as well as the rehabilitative work. It also helps us look about how we can reinforce each other, both in time and space. So time, how the preventative work can interact with the crisis-oriented work, as well as space in terms of within one chapter, how can our interventions reinforce each other? So this timeline tool helps us to evaluate both. And then it also helps us to ask the question, okay, with all the ideas that we've developed, with all the things that we've committed to do within the next year to 3 years, let's ask the question, within Asha's situation, does it actually change the probability that Asha will be bullied? For example, if what we come out of our design seminar is 50 more training seminars and 50 more like brochures for bullies to go through when they're in detention, does that actually change the probability of the outcome that Asha is going to be bullied? So if all of our interventions coming out of it are basically doing more of the same things, does that actually change the outcome? See, design thinking is going to help us to evaluate that by looking at her context. So that's the basic process that we're going to follow here. We're going to create a table of contents of her life. We're going to empathize with the chapter. We're going to see where we fit within that chapter, and we're going to start asking that question, will we actually change the outcome? That's the basic process of this particular design tool. So here's Asha's story for those who don't have the PDF. Starts by looking at her family background and then talk about her early life, maybe entrance to California, things like this, her life entering school. And then the middle school chapter is the chapter that we're actually going to focus on to develop. So for those looking at the PDF, that's actually blank. Then her time in high school, it looks beyond that to maybe she gets pregnant, she becomes a single mom, her survival, and then eventual the rehab process, and where she really takes ownership for her story. So we're actually going to focus for the time we have in this webinar to focus specifically on chapter 4. And chapter 4 is her middle school years. And so I think for many of us, middle school is some of the most difficult memories perhaps we have from school, where children are just starting to realize they have a will of their own. They're not sure how to connect and formulate that identity that's starting to form within themselves. And so a lot of bullying actually happens there. Okay. So here's what I want you to do. We're going to break out into groups in a second, and we're going to fill in what we think is happening in chapter 4. It says, what are some key things, key words or phrases that you would expect to characterize life in this chapter of her life? So don't just think in terms of bullying. Think in terms of widen your scope here. Think in terms of her relations to family. Think in terms of like what place is she at, home or school, or is it an online context? What roles are active in her life right now? Teachers, kids, parents. And think not just in terms of physical bullying, but in terms of what's happening mentally, spiritually, emotionally for Asha. I'll talk through what to do. So what's going to happen is you're going to click that link, and you can just watch what I do on the screen here. So from our breakout group, we had now each of us has a different instance of this. So please click on that link in chat. If you don't know where the chat is, Dan can help you out. But if you click that link, it'll bring up this box. And just as an example, I'm going to type the words from my group. You guys type, whoever the scribe is, type the words from your group. Just while people are inputting that, I'll just talk for a little bit. What you'll start seeing is that as common terms come into the cloud, then words will get bigger. The thing is that the technology to do design work and design thinking has massively progressed in the past 10 years. I actually wrote a book, which you'll see, it'll be available to you for free if you do a feedback on this seminar. But that book was written 10, 12 years ago, and the technology to do all this has massively advanced. So it'll be useful for understanding the process, but in terms of implementing it, there's a lot more out there. All right, just for the sake of time, I think I'm going to move on. You guys get the idea. Basically, as we brainstorm that, this is a good example of what might happen in a conversation about what's happening within the chapter. Typically, I'll break groups out into groups of 5 or 6 people, and they'll have this type of conversation as they build chapters. And so common issues that, through an iterative process, you can see here there's many ideas, but there are some ideas that are coming out very clearly, right? So the issue of insecurity is seen many times. The issue of loneliness and isolation is seen many times. The feeling of fear or vulnerability is a common word. Identity issues and forming identity is a common one. So these types of things are what we would use to build out that chapter. And the idea is not to write a story or a whole chapter of the story. The idea is to identify what are some really key things that are happening in Asha's life right now that we need to be paying attention to and really round that out well. So we've taken about maybe 3 to 5 minutes to do what would normally take 45 minutes to an hour and a half in an actual design session. But you've gotten at least the experience of that piece of it. So what we've done is we've actually built out that chapter. So what we're going to do now is we're going to define some of the key issues related to changing that story. So the question, when we look at the story as a whole, the question that often comes to mind is, my goodness, this is massive. It's absolutely overwhelming. What can we do? There's just so much that can go wrong. And that's really the wrong accent in the question. The thing is not to find the silver bullet. It should be fairly obvious once we move into design work that no one has the silver bullet. That it doesn't exist. Thinking about change in a situation like that is like taking a rifle bullet and thinking you're going to stop a whirlpool by shooting at it with rifle bullets. It's not going to work. A whirlpool is created because of contextual factors. Shooting at it is not going to do anything but make a big splash. So the question that comes to mind through design thinking is not what is the silver bullet, but what can we do? What are we able to do? Something that would make sense to Asha. So first question is, what can my group do? Okay, so your piece of the puzzle, where could that plug in? So specifically within that chapter 4 that we just looked at and developed, where does your piece of the puzzle plug into that particular chapter? And then what could we do together that would make sense to Asha? In other words, how could I reinforce you? How could you reinforce me as we work within the context of this person's life? So what we're going to do is we're not going to take the time at this stage to go back into our breakout groups and talk about how our ideas plug into that. What I want you to do is, looking back at that note that you wrote at the beginning of the session where you had your best idea. There's that little red background and a guy pointing at a light bulb, and you'd written down some of your key ideas, your best thinking about how to prevent or reduce bullying in this school for immigrants in California. What I want you to do is actually share one of your best ideas to reduce bullying and share that right into the chat window right now. So I'm going to give you a minute to do that. Go ahead and type into the chat window. Make sure you're sharing to everyone, not just to one person. Make sure it says everyone. And I want you to choose one of your ideas, your favorite idea from that list you initially wrote out, and I want you to type it into the chat box right now. Excellent. Okay, so here's the thing. As we're loading these ideas into chat here, this really helps to mirror the activity of an actual design workshop. So there are literally hundreds of ideas that are generated. I worked with one group focused on human trafficking in India one time, and they generated over 250 ideas within the time that we were together. That was just 2 days. And so what happens is, as you're generating these ideas, a lot of these ideas at the beginning of it will be generated around the piece you bring to the table. As the session moves forward, those ideas become more complex, more adaptive, more varied over time, and that's a really neat thing to see. So what we're going to do now is we're going to look at how do we, come on, oh, click down. So this is the ideate phase, generating the ideas. What we're going to find is that there is a need not so much to implement hundreds of ideas, but find a way to prioritize what we're actually going to do. Now, we don't have the time to get into breakout groups again, so what we're going to do is drop another link into chat, and we have actually preloaded 4 key ideas within the chat, within the activity, just to give you guys a sense for, this is a prioritization activity, one that's very common and you could use, but it gives you a sense of how to prioritize some of these actions and sort of tease out what does strategic look like. So what we're going to do is assess potential actions in light of 2 factors. Number 1, probable impact. You know, what's the likelihood that this will change Asha's situation? And the second one, how much effort is this going to actually take? Okay, while you're working then on that, I'll just talk us through this. So essentially, this is one of many, many tools that you can use within a design workshop, a design thinking seminar, where you can start to prioritize and tease out what are the most strategic things that we can do here and now. So out of these ideas, um, the one that we're definitely not going to work with is number 2, right? So because that's very high effort, but not so much impact um, in comparison to other ideas that we have. This one, number 3, passing out daisies, very low effort, but not real high impact. Number 4, maybe it's a little better, but there's going to be some unintended consequences coming out of that one. What you're going to see here is this is the range of voting that we got. Some people thought it was very high impact, very high effort, but very low impact, stiffer penalties. Other people thought it would be very high impact with very low effort. So finding a way to average out responses is really important. I'll click on this one as well. Again, we have a range of responses here. So you're going to have to find tools and use tools within your design activities to start identifying, what are we actually going to do? Now, this range of responses here, especially with our number 1 idea, really shows the value of not just having intuitive ideas about what's a good idea. This very broad spread helps us to see the importance of having some kind of shared idea of Asha's situation in order to assess these ideas. So right now we did this with reference to just our intuition. But if we were to do this within a design workshop, we would actually refer back to places within her storyline to say when and where and why these types of interventions would be most significant. So just for the sake of time, I'm going to move us out again. Here's the key question. Let's say that we're at the end of a 2 to 3 day design workshop. We still have to deal with the question of, did we actually change the probability? All these things that we've adopted, the ways we're going to reinforce each other, the new ways we're going to plug in our existing interventions. At the end of the day, zooming out across her timeline, does this actually change the probability that Asha is going to be bullied within her experience of the schools in California as an immigrant? It's absolutely vital that at the end of the design workshop, you zoom out and ask that question. Otherwise, people feel lost. When you ask that question, you'll get mixed responses, and that's okay. When you zoom out, what's going to happen is people will be less defending their idea and more talking about why XYZ makes sense in Asha's situation. That is the change that you want design thinking to bring. What you want, the design thinking key outcome is the participants themselves that take that richer, more integrated, more shared view of the context into every situation, every meeting, every decision that they're going to face from now on. So you're having that wider, more systemic effect. Okay, so sorry, one more thing. Why are we talking probabilities? Here's the reason why we're talking probabilities. We're not saying what are the outputs of the program. We're not saying how many bullies will go through our training. We're not saying, choosing some type of number off the top of our heads out of the hundreds of thousands of kids in California. We're going to drop that number by 362. We're not doing that. What we're doing is we're looking at our context and how it works. We're looking at our interventions. And then I actually have a tool that helps us to create some metrics of, are we reducing the probability? And all of those metrics, like any type of numbers, they mean what they mean, and they're based on the input and the predictive analysis of both the tool and the people involved. So no, it's not absolute. But there are tools that we can use to assess the probability of are we changing what's happening within the system as a whole. So if you want more information on that, I can help you with that off this webinar. But always ask that question. We're not talking about outputs. We're not talking about, you know, specific numbers of programs. What we're talking about is, are we changing the situation itself and how it works? That's why we use the word probability. So just for a review here, design thinking is a creative, iterative, structured process by which we empathize deeply with a person that we're trying to work with, and then we create a collaborative strategic intervention. You use design thinking for unstructured, mildly understood problems where there's great complexity in whatever the situation is that you're trying to change and the outcomes you're looking for. The basic stages of design thinking is to empathize with a life situation that you're working with, to define the problem space that you're working in, create ideas, prioritize those ideas, and then prototype. In other words, that's a step we didn't do, right? We started to prioritize those ideas, but we didn't come up with here's how that would converge. And then testing we did do. We did zoom out and we asked the question, does this actually change the probability of bullying in the schools? So just very briefly, that's an overview of what we've looked at here. Now, obviously, this is a short taste to a very, very large field. Design thinking is no longer in its infancy. It is literally an industry at this point in time. So here, if you're just getting started with design thinking, here's some terms that you can Google. Design thinking, human-centered design, innovation, specifically look for Stanford when you're looking for innovation. Systems thinking, complex adaptive systems, those are all terms that you can write into Google and come up with more material that you're ever going to read in your lifetime on this subject. Some groups who are active in this area, I know this is a group that's focused on Christian mission. So some Christian mission consultants within this space specifically. I work in this space. John Hirsch and his group, Generous Minds, are exquisite within this space, especially when it comes to the, you know, now you've done the innovation space, how are you going to get your board involved? How are you going to get your people on board? How are you going to start assessing these interventions? A great group to be involved in. They have webinars I would encourage you to go to. Generous Minds. Also, Rob Wassel and his group of pioneers called Seeds have started a design lab as well. All those people would be fully on board with your with the mission aims that you have. There are secular nonprofit groups that are absolutely excellent in their treatment and use of design thinking for cooperative intervention. And so Stanford is probably the standard in terms of the innovative process. When you type that into Google, innovation, design thinking, Stanford, that's the first match you're going to get. IDEO is another group, Ashoka, FSG, Foundation Strategy Group. These are all excellent in that space, and there are many, many more. These are just examples. Some resources, here's 3 books that I would encourage you to read. SCAN, The Strategic Context Assessment for Networks. That's a book that I wrote over almost 10 years ago now. But that would actually be available to you free as a PDF download if you fill out the evaluation at the end of this webinar that Dan's going to send out to you. A great primer for systems thinking is by Donella Meadows. And then if you're more of just give me some tools, then this systems, sorry, I'm not seeing the thing here. Thank you. Systems Concepts in Action, Practitioner's Toolkit is a great first book to read on this, as well as some work that you can do on the web. So, Dan, I'm going to hand it over to you, and thank you everybody so much for the time.